Okay, we're going to do the knee examination. So to begin with, I'm going to start off with inspecting the patient from the front, looking for symmetry, muscle bulking, any valgus or varus deformity of the knees. So can you put your feet together, please? Okay. And I'm also going to inspect from behind as well, again looking for muscle bulking and symmetry. And pull your feet apart for me. And also arches of the feet. Okay, so once I've done that, can you walk up and down for me, inspecting the gait for symmetry, and turn back for me. Looking for any deformities of the knee joints. Okay, and then also in a biomechanical assessment, can you walk on your tiptoes, please? See if the patient is limping or able to do that, and then come back with your heels, walking on your heels for me. So able to do that, which signifies as good muscle strength. And to complete the kinetic chain assessment, I'm going to ask you to squat on one leg for me. Try and get to 90 degrees of your hip and your knee. Okay, and back up. And then the same again on the other side. Okay, so not too bad. I'm looking for any rotation of the knee joint, any dipping of the pelvis, and is the patient able to do it, which you were, which is good. Okay, can you lie down for me? So before I'm inspecting the knee joints, I just want to clear the joints above the knee. Which you can get referred pain from the lumbar spine and also from the hip. So do you have any back pain at the moment?
No.
Any numbness in your legs at all?
No. Okay,
so can you just lift this leg up as high as you can for me? Good, and then back down. Any pain at all there?
No.
Okay, can you wiggle your toes for me? Okay, good. I'm going to have a feel of pulses as well. Okay, can you push down on my feet and then push up on my feet? Okay, good. And can you feel me touching you on both sides? Does that feel equal?
Yeah.
Okay, good. All right. And then I just want to assess the hip joint as well. So I'm just going to get the knee and flex it and internally, externally and internally rotate. Any pain there at all?
No.
Okay, so I'm quite satisfied there's no lumbar or hip pathology at this moment in time. So I'm just going to go on to inspection again while the patient is supine. So again, have a look at muscle bulking, the patellas, are they pointing in and outwards or straight on? Have a look at the legs as well, are they equal length, any bruising or wasting? So once I've gone from inspection, I'm going to go on to palpation next. So I'm going to start off with palpating the quadriceps and the quadricep tendon into the patella. Okay, I'm going to feel the superior and inferior poles of the patella. Go down to the patella tendon. Any pain?
No.
And also feel the tibial tuberosity there, which would be positive in Osgood-Schlatter's syndrome. I'm going to have a feel medially as well, any pain, which may signify medial collateral ligament pathology or osteoarthritis. And again, laterally, I'm going to have a feel again for lateral collateral ligament, and have a feel posteriorly for any cysts, Baker's cysts, swellings. Okay. And if you could lie on your left hand side, this just exposes, and just bend your knee slightly, this just exposes the iliotibial band. So I'm going to have a feel there on the iliotibial band for any pain. Not too hard though. And also on the lateral epicondyle where the iliotibial band crosses. So if you just want to bend this knee, I'm going to just keep my thumb on the lateral epicondyle and extend and see if that causes any pain as the iliotibial band passes over that lateral epicondyle, and that feels okay. Okay, good. Do you want to line your back for me? So I've done inspection, I've done palpation. I want to assess movements now. So could you fully bend your knee? Okay. So that's active flexion. Okay, and then come back down. And again, to assess extension, just keep your leg straight and just lift it up slightly. Okay, good, fine. So I want to do that for the patient now. So I'm going to bend your knee and assess for any crepitus, pain, range of motion. So it's about 120, 130. And again, I'm just going to passively assess extension now, and to see if there is any hyperextension. Once I've done my passive movements, I want to assess power now. So could you lift your leg up straight off the bed for me, and don't let me push it down. Okay, good. So I'm assessing the quadriceps there. That's great. So just bend your knee against my pressure. So keep bending against the knee, bending the knee, bending the knee, bending the knee. Good. So that's assessing the hamstring power. And then can you just pulse my hand like a pedal? So that's assessing the calf muscle there. So I'd like to do that on equal sides just to compare, but there seems to be good power on this leg. Okay, so once I've assessed my movements, I want to go on to assess the knee in a bit more detail. So again, I'm just going to have a look at the knee and look for any effusion specifically. So to do this, I can milk the knee downwards to try and exaggerate any fluids that's there, and I can blot the patella tap, and whilst I've milked the knee down, I can also milk the medial border and see if that causes any fluid bulge on this lateral border, which there doesn't seem to be any effusion. Okay, so I've looked at effusion now, so I want to assess the ligaments of the knee. So I'm going to assess the ACL ligament first. So that's the first test I'm going to do for that is Lachman's test. So I'm going to hold above the knee to stabilise that, and I'm going to try and see if there is any laxity when pulling the knee forward. Okay, and again I would compare that on both sides. Again, I can do the drawer test. So could you just bend your knee for me? I'm just going to sit on this knee, and the drawer test is similar. I'm just going to pull for any anterior give there, which again there doesn't seem to be. Moving from the ACL to the PCL, so I'm just going to get both of your knees there and feet on the bed, and I'm going to look at any posterior sag, which there doesn't seem to be. And then to complete the PCL assessment, I'm going to push back, and again if there's any posterior give there, again that doesn't seem to be there. Moving on from the cruciate ligaments to the lateral and medial collateral ligaments. So I'm going to slightly flex the knee at about 20 degrees, and then I'm going to stress the knee in a valgus stress to assess that medial border and see if there's any pain or laxity, and then slightly switch over and do a varus stress to assess that lateral ligament. No pain there at all?
No.
Okay, good. So I've done my ligaments, I've done the fusion. I'd want to assess internal structures of the joint, so the meniscus. So to do that, I would usually do the McMurray's test. So I'd warn the patient because it's not very comfortable, this test, so apologies. So I would want the patient to fully flex the knee, so get the knee into full flexion. I'm going to put my hands and grip the joint lines, and then I'm going to just internally and externally rotate the knee and try and stress the medial menisci, see if there's any popping, clicking, pain, and then also some lateral stress, again trying to internally and externally rotate the tibia onto that meniscus and trying to elicit some pain or discomfort. So I'm happy that there's no meniscal pathology here. Just going back, when I had the patient's knee flexed at 90 degrees there, it's important to have a good feel of the medial and lateral joint lines. If there's any pain, it's not very specific, but that can also signify meniscal injury, osteoarthritis, or ligamentous injury on either side. Okay, so the final test that I'd like to do is just look at the patella in a bit more detail. So we've already done the patella tap. I'm going to just stress the patella laterally, medially, superiorly and inferiorly for any glide. And I can also at this stage perform an apprehension test of the patella. So most patella dislocations happen laterally, so I can really stress that lateral force there, and if the patient is really struggling with that, then that would signify that there's a high likelihood of patella dislocation. So that completes the examination.